G'day everyone, this is Aussie OcDoc, and thank you for visiting my channel, What's OcDoc. I'm a doctor from Australia, and I specialise in the field known as occupational medicine. This video will be slightly different from my other videos, as I will be covering the current situation of COVID-19, as well as what is being done to minimise risk of transmission in the workplace. This is a constantly changing situation, therefore I want to stress that the purpose of this video is to provide generalized information to inform the public about what is currently happening only. Please seek and follow the advice of your local health authorities in your own country. First thing is to know, what is COVID-19? COVID-19 is a coronavirus and is a part of a large family of viruses which cause infection in both animals and humans. In humans, these can range from the common cold to severe disease such as severe acute respiratory syndrome or SARS, which caused an outbreak in 2002 to 2003, and Middle East respiratory syndrome (MERS), which had outbreaks in 2015 and 2018. This type of virus typically causes infections of the respiratory tract, which includes the mouth and nose all the way down to the deep parts of the lungs. This new infectious agent was first reported in late 2019, emerging from Wuhan in China, likely spread from animals to humans. This coronavirus is novel, meaning that it has never been previously identified in humans, and therefore we currently do not have any previous immunity to it. The infectiveness and severity of symptoms are also different to other coronaviruses such as SARS, and therefore direct comparisons cannot be made. Limited information is currently available about many aspects of the disease, and the information that we currently have is largely from reports coming out of China, and therefore is subject to change as authorities get a hold of new information. Transmission is primarily from close person-to-person contact via respiratory droplets produced from coughing by an infected person. There is also evidence that these droplets linger in the air as well as deposit on common objects or surfaces such as doorknobs for periods ranging from hours to several days. Touching infected surfaces and then touching your nose, eyes, or mouth is another potential path of transmission. The time between catching the virus and when symptoms first start occurring is called the incubation time. Currently, this is estimated to range from 1 to 14 days, with an average of 5 days. People are most contagious when they have active symptoms. Individuals with COVID-19 have commonly reported symptoms ranging from fever, cough, fatigue, and difficulty breathing. It has been reported for the majority of people infected, they will likely only experience mild symptoms that will resolve on their own. But some positive cases have been reported to be asymptomatic, meaning that they have no symptoms at all, and therefore are potentially spreading the disease unknowingly. Those at higher risk of developing more serious symptoms are believed to be the elderly, people with pre-existing chronic health conditions such as heart disease, diabetes, and lung diseases, and immune-compromised individuals. In severe cases, development of pneumonia, respiratory distress, and multi-organ failure can also occur. Current data suggests that the rate of transmission of COVID-19 is higher than other viruses such as influenza, owing to it being a novel virus, having longer incubation periods, and having mild or no symptoms while contagious. This has resulted in the rapid spread from China to other countries, eventually leading the WHO to announce it as a pandemic on the 11th of March 2020. There is no set definition of what a pandemic is. However, it's generally described as a worldwide spread of a new disease. This is different to an epidemic, which is what it was previously classified as, which is an occurrence of cases of disease in excess of what would normally be expected in a large geographical area. The announcement of a pandemic, therefore, signals to all world governments to enact their own risk management strategies in order to implement effective infection control plans in their own countries. The rising number of reported cases around the globe has led many countries to adopt a strategy of mitigation, which aims to slow down the rate of infection in the community in order to not overwhelm the healthcare system's ability to treat those affected with disease and hopefully increase the chance of survival. This can be done through various interventions, including heavily restricting entry into a country's border, requiring those with high risk of having COVID-19 to self-quarantine for 14 days, banning large gatherings of people, including sporting events, conferences, and festivals, encourage all citizens to practice social distancing, which involves keeping away from others as much as possible and avoiding visiting public areas with lots of people. Effective testing of all those with potential symptoms and risk factors, allowing for early tracing and isolation to limit spread. If all these interventions are delayed, as was seen in Italy, the rapid rise in new cases will go beyond the ability for the healthcare system to cope, leading to the tragic events currently occurring there. If, however, we are able to implement these strategies early, we can flatten the curve. This can reduce the rate of new cases to a manageable level, so that our hospitals are able to treat them successfully and hopefully provide enough time for the development of a vaccine or specific therapies for COVID-19, which currently is estimated to be 18 months away. In terms of a workplace, a pandemic can potentially cause huge disruptions to a business, particularly in terms of staffing issues. Potentially a significant proportion of the workforce can be affected for an extended period of time. Change in the pattern of commerce. The consumer demand can drastically change depending on how an industry is affected. One industry that is heavily affected currently is the airline industry. There can also be interruptions to supply and delivery. For a business, it is critical to develop and implement an infectious disease preparedness and response plan. This can be done firstly by doing a risk management assessment of the workplace and creating policies and procedures relevant to your business. You will then need to appoint a representative or a team to oversee this role. You also need to keep up to date with guidance provided by state and national governments and filter this information to all relevant parties. There should also be an ongoing review and evaluation of the control measures that are currently in place. A recovery plan should also be implemented once the current situation has resolved and transition back to normal work can occur. In terms of workplace controls, engineering controls would be the first starting point. This would involve putting in place barriers to isolate employees from potential exposure. This could include restricting all unnecessary entry to a workplace and implementing screening if appropriate. Ensure that ventilation and air conditioning in the workplace is well maintained, and where appropriate, designate special rooms for isolation of potentially infected workers. For administrative controls, policies and procedures need to be in place to allow effective infection control as well as safe working practices. Examples include educating and encouraging workers to self-monitor for symptoms and if sick, stay home, practice social distancing. This includes only having essential employees on site, switch to telephone or video conferencing for meetings, provide alternative work arrangements such as working from home, provide adequate hand washing facilities, regular cleaning of the workplace, particularly wiping down objects or surfaces in common areas, advise all employees to avoid all unnecessary travel, particularly overseas, provide access to support services such as employee assistance programs, or have a point of contact for workers to have counseling and ask questions. Allow workers to access available entitlements if required to take time off work. In terms of PPE, this is mostly relevant to those exposed to high risk of infection, such as healthcare workers. PPE should not take the place of other controls listed previously. Examples can include gloves, goggles, face shield, face masks where appropriate. Training needs to be provided on the use of PPE, properly fitted, consistently used, and maintained for optimal protection. So what can you personally do to protect yourself? Regular hand washing is critical, particularly if you're in contact with commonly shared objects and frequent public areas. Washing your hands should be done with soap and water for at least 20 to 30 seconds, making sure that all areas of the hands are clean. Hands then should be dried completely. If soap and water is not available, then an alcohol-based hand sanitizer can also be used. The WHO has developed an excellent protocol on how to clean your hands to protect against infection. You also want to limit contact with others, particularly physical contact such as shaking hands and maintaining a distance of 1 meter between yourself and others. Avoid touching your eyes, nose, and mouth. If you yourself are coughing, please follow good hygiene and cover your mouth with a tissue and dispose of it right away. Otherwise, use your elbow as a cover. Stay at home if you feel unwell and contact your GP by phone for advice on how to proceed. Do not present to your clinic and potentially infect others or unnecessarily burdening the emergency department. Practice social distancing, which is avoiding all unnecessary public areas or gatherings of people. Masks are generally not needed unless you are confirmed to have COVID-19 or currently having symptoms. This is also to reduce the burden of supplies needed by the frontline health workers which need them the most. You should also keep healthy and active. If you smoke, please stop smoking as this is a potential risk factor. If you're on any medication for any pre-existing disease, please continue to take them as directed. Stay up to date with the flu vaccination. Although it doesn't directly affect the development of COVID-19, it avoids the risk of having both infections concurrently. Finally, keep informed of the latest updates from your local health authorities. So in summary, maintain good personal hygiene, stay healthy both physically and mentally, practice social distancing, keep informed of the development in your country and follow the advice of your local health department, and finally, act conscientiously and try to help those in your community that are more vulnerable. Thank you for watching this video. I hope that I provided you with some valuable information in the area of occupational medicine. I value any feedback, therefore please feel free to leave a comment on any of my videos, as well as a like if you enjoyed it. If you find my content of value, please subscribe and share them with your family and colleagues. Have a good day.